Hello, my dear student. This is the first video on the series video on OSPE. Actually, this question uh, seen in the last final of MBBS exam under Russia University. At first, I read the question and the scenario, and then I try to answer the following question. A 60 years old man presented with cough and exertional breathlessness. On examination, his nails are like these. I just changed the figure and put some real photo from my collection. At first, the scenario is 60 years, 60 years, male patient, presented with cough and exertional breathlessness. Okay. On examination, some abnormality in his nail. Nail is like this. What is the problem with his nail? Another photo from my collection. This is actually this is a picture of clubbing of the finger nail. In clubbing, increase curvature of the nail plate and swelling of the terminal phalanx. This is the terminal phalanx, and overall it seems to be swell up. Another photo here. Look this terminal phalanx. It is somewhat bigger than it should be. Is not it? Terminal phalanx is swollen and the nail plate is carved. Terminal phalanx is carved. Parrot beak appearance. So this is a definitive case of clubbing of finger nail. Now go to the question. What are the finding in his nail? This is the first question. What are the finding in his nail? So for this question, the answer is increased curvature of nail plate. Number one. Number two, swelling of terminal phalanx. Okay, of the hand. Okay. The next question is write down 4 important causes of this condition. Maximum student will do some wrong with this question. You know what are the causes of clubbing as a whole. There are some respiratory cause, you know, some cardiovascular cause, you know, some GIT cause, you know, and some other cause, you know. In respiratory cause, for example, it may be tubercular, it may be due to bronchiectasis, maybe due to empyema, maybe due to lung abscess, maybe due to lung cancer, or maybe due to pulmonary fibrosis from interstitial lung disease. These are the important respiratory cause of clubbing, you know. In CVS, there are some cause, most importantly, cyanotic congenital heart disease, cyanotic congenital heart disease, and sometimes infective endocarditis. Actually, these two are the important cause of clubbing from the CVS cardiovascular system. In GIT, you know the causes of clubbing are most importantly cirrhosis of liver, then inflammatory bowel disease, then celiac disease. Celiac disease. CD means not Crohn's disease here, celiac disease. And inside the IBD, there are two entity, Crohn's disease and ulcerative colitis. Okay, and other cause means maybe thyrotoxicosis, that is thyroid acropathy, or it may be due to a primary hypertrophic osteoarthropathy. So these are the cause from our textbook like Davidson. But look at the scenario again. The scenario is very important. 60 years, a 60, that means a old person, cough and exertional breathlessness. That means the old patient, a senior citizen, present with cough and breathlessness, that is exertional. So this clubbing might be related to the respiratory system most importantly, and maybe cardiovascular system. Okay, so at first you should put some cause from the respiratory system, and then you may go to put some the causes from cardiovascular system. So at first, go with the respiratory cause like tuberculosis, bronchiectasis, empyema, lung abscess, lung cancer, pulmonary fibrosis. Okay, and from the CVS, congenital sciatic heart disease. Is this point is in favor of this scenario? No, as because the patient is older, 60 years. Congenital heart disease should not go with this older patient. Okay, rather infective endocarditis may be fitted with this old person, as because subacute bacterial endocarditis we know in older patient uh, may be the case uh, without any uh, fever. Without any fever, infective endocarditis may occur in older patient with significant weight loss, of course, and patient may suffer from exertional breathlessness due to some sort of valvular regurgitation, even heart failure, or maybe pulmonary thromboembolism that might be caused by infective endocarditis. So if you want, you may put one point that is infective endocarditis as the cause of this clubbing in these 60 years old patient with exertional breathlessness and cough. So you should put the cause from most importantly from the respiratory system. And if you want, you may put one cause from the cardiovascular system, but you may go just through you may go through with just the causes from the respiratory system, not other system like infective endocarditis. And this cause, I think these cause are not relevant with this scenario. Okay. Now, how will you investigate this man? This is the last question. How will you investigate this man? As this patient, 60 years, cough, exertional breathlessness, and you put the cause most importantly from the respiratory system and infective endocarditis. So list of investigation like should be chest X-ray, CXR, PFU, ECG, CBC with ESR, CRP, echo. These are the primary level of investigation for this patient. Just put this investigation. A bigger list of investigation uh, is not for this type of question, as because it is a OSPE type question. You should put little smaller list of investigation, a smaller list of cause or anything else. No big list you should put this type of course in this type of course. So this first X-ray is on the clubbing. The next question will be on spirometer, I think. Thank you very much.